As requirements for wearing a mask increase, it's important to take a few minutes to focus on your skin. That's why Kristina Petkovic is here. She's a nurse practitioner from Apex Skin. It is great to see you, and your skin looks lovely.
Oh, thank you.
Especially on this side, it's very bright.
That's my good side.
That's your good side. You've got all good sides here. And we're talking about how things have changed because we're wearing masks. Like I'm 100 years old, and I noticed I'm getting like zits or pimples from wearing the mask or something. Is that possible?
Yeah, it is. We are seeing a lot of skin irritations and acne that's coming up with the mask. The masks tend to make us sweat. They're, kind of uncomfortable. So really finding the right fit for your face is important.
Okay, so are these products we're going to talk about, are these things you use before you put the mask on or after you put the mask on? What's the game?
Well, if you have sensitive skin, you want to make sure that you're using a mask that's comfortable so it doesn't cause irritation or rubbing. Cotton fabric tends to be the best one out there right now. Making sure you wash your face with like a hypoallergenic cleanser prior to wearing the mask, and of course after wearing the mask every single time to make sure it stays clean. And you want to make sure the mask fits right so it doesn't rub on different spots. So washing our faces and a right fitting, comfortable mask is really going to get you to good skin health.
Okay, so why don't we start with early in the morning. You get up in the morning, you take that shower. How do you start preparing your face for the mask in the day?
Well, we should always wash our faces twice a day. So using a cleanser that's gentle on our skin. If you have oily skin, you can use something that has salicylic acid in it. Neutrogena Acne Wash is a great one. CeraVe Renewing Cleanser is a great one. If you have dry skin, you could use something with like a hyaluronic acid in it because it binds to water, keeps the moisture in the skin. Neutrogena also has a great one called Hydro Boost, and CeraVe Hydrating Cleanser is another good one. These are all over-the-counter products. Of course, Apex has great products. We can help you if you're not too sure what kind of skin type you have. So Cetaphil is another good one. And Zeo makes a great hydrating cleanser as well. One other thing that you want to remember is protecting that skin by using a barrier, something like Aquaphor or Vaseline to protect it from skin breakdown.
Okay, I'm learning a lot right now. So if I want to take care of my skin, like I go to Apex Skincare, right? So
Absolutely.
Do I wait to go until I got some kind of crazy thing going on and my head's going to fall off, or do I go as a preventative thing, or what inspires me to go to Apex to get myself on the right track?
Honestly, both. If you're having an issue or you're not too sure what's going on with your skin, that's what we're here for. We're here to help. We're here to guide you and make sure that you have good skin. If you are having a rash or more acne breakouts or anything that you're concerned about, always come to us. You can either come before and have a consult, or you can come when you're actually having the issue and we can figure out what it is.
Is there a brand new problem that you haven't seen very often that all of a sudden you're seeing more of right now that people might be concerned with?
A brand new problem, not so much, but if you have an underlying skin condition like rosacea, or if you already have acne-prone skin, a lot of people that are wearing masks tend to be coming into the office with exacerbation of these skin conditions because the masks don't let they don't let our skin breathe. Yeah. So you really got to make sure you got a good mask that's protecting you, but it's also good for you.
I know, like when people need something from a doctor right now, a lot of times you have to do it on the computer, face to face, almost like a Zoom call or something like that. And you're sticking your head closer back and forth and all that sort of thing. What's the deal at Apex? If you want to become a patient or you want to have a doc look at you, what do you do?
Oh, well, we take pictures. So if you do a telemedicine conference call, you could always take pictures of the trouble area and then send it to us via email ahead of time. A lot of that stuff is on our website at apexskin.com, or you could just call the office and ask, and then we'll set you up. We take a look at it as a provider ahead of time so we know what we're kind of focusing on and what our issue is, and then we go from there. If it's something that is a serious concern, we're making sure that we're practicing all the guidelines, and it's safe to come into our offices as long as you're wearing a mask. We're wearing our mask. We're following social distancing and making sure everyone's doing what they need to do.
That's really good news. And how about paying? What kind of insurances? Do you take insurance claims and that sort of thing?
Yes, I take a whole bunch of insurance. Every provider does. Honestly, the front desk usually answers those questions for me.
That's very funny. That's great. So we were talking earlier, I was asking how many locations, because it seems like your success has caused a multiplying of your locations. So how many locations now, where are they?
Right now we have 7 offices, and we're about to open a brand new office in Ashtabula. It's going to be our 8th office, so we're super excited. It's going to be located in the Ashtabula Family Health Center, and you can find all the information online. It's slowly coming out there, so we're excited to be there.
Okay, so I got a little problem. I get on the phone, I call you, and you put the wheels in motion, and then pretty soon I'm going to be in good shape.
833 Apex Skin. Easy to remember.
There you go. Thank you very much. Great to see you.
Great to see you. Thanks for having me.
You have beautiful skin.
Oh, thank you.